Hey, welcome, 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 welcome. Thank you for joining us tonight. All things business. This is the episode 5 and season 5 recap tonight. And unfortunately, my doctor, my private doctor, Dr. Lindsay Hansen, was called away to do a speech, speech. So he won't be joining us tonight, but we're going to fill that in. And we're going to talk a little bit about the insights of doctors and medications and that kind of thing. And in the industry, because the industry is changing so much drastically today that a lot of people can't afford insurance or can't afford health insurance. So we're going to explore a little bit about that this evening. And with me, I have none other Miss Kathleen Williams from Sacramento. Miss Kathleen Williams, are you there?
Yes, I am. Good evening, sir.
How you doing?
I am doing fantastic.
Yes, and audience, the reason why we asked her to join tonight because she has 30 plus years in the medical field, and I just want her to add on to what she sees from the inside looking out, because I know from the outside looking in, it's a different picture. So give us a little bit of your background, and we'll also join before we go there. We got joined by Miss Sherry on. How you doing, dear? Afante,
I'm
how you doing?
I'm wonderful, sir. How are you?
Good, and she has a background in out there rescuing kids and things, and I'm sure she sees some things in healthcare and health industry that she wants to expound on as well. So with that said, Miss Kathy Williams, tell us a little bit about your background and how long you've been in the nursing field.
I started my nursing career as a office nurse for a small hometown doctor in 1968. And with his encouragement and with my personal dedication that I had before I ever met him, I went into nursing school and paid my way through. Finished school in 1972 and have been a nurse since. Now, nursing covers a lot of areas, just like medicine does. And I've probably worked in every one of them over the last 50 plus years until I retired in 2022. And healthcare, oh my God, it's changed. It has changed in ways that it's hard to explain. And it leaves me with a sense of anybody that I can help with healthcare, I try to.
Yeah. Give me a couple things that you see that change. I mean, we all see it change, but you'll be on the inside. We're looking on from the outside. As a nurse, what have you seen change in the years? And how many years was that since 1972 to now?
50.
50 years as a nurse. Wow. Wow. Thank you for your service. So give me a top 3 or 4 things you see has changed drastically in the industry since then to where we're at today.
One big change I've seen is that when I started in 72, healthcare was patient-centered. By the time I retired, it became profit-centered. And I don't care which part of healthcare you're in, it's become profit-centered to the point that especially in the hospital setting, nurses have gone from being respected to the point that now they're fighting for what they need. I will tell you, when I graduated in 72, I said, I'll never work at a hospital that is unionized. By the time 20,000 rolled around, my whole outlook had changed. And I would say to the young nurses, you need to work in an institution where it is unionized, because healthcare had become so financially based that it was to protect them and protect themselves and their license.
Yeah. So we went from patient-centered to profit-centered, which makes a lot of sense. You know, as I was thinking about it, this past week, I went to see my doctor Dr. Hansen to get my blood work done. And then I go see him next Monday to go through everything that came out of it, my panels and all that stuff. And I like the idea of the concierge doctor, like you talked about on the video today. If y'all watched the video, it was early this morning. If you haven't, go back and watch it after this is over. But he talks about being a concierge doctor, which I love the idea of concierge doctor. He's more in tune to the patient. He knows my chart. He knows me. My kids and his kids went to school together. So there's a personal connection. It's a friend. And also as a primary internalist, I can call him no matter where I'm at in the world. If I need something, I give him what's going on with my body. He knows me, knows my body because he got my charts, and he subscribes something. And I go to the nearest pharmacy. I'll find out where it is, and they'll send it there for me. And there's a big difference. And I think today, successful people, and I wish everybody could have that, but like I say, you work hard in a business setting. You want to be able to have a concierge doctor if you can. And like he said on the channel, if you guys listened to it earlier today, he said it costs anywhere from $2,500 to $3,000 a year. And then he also said on the video this morning, what is it worth for you? And I think, it's worth it for me. And like I said on the video earlier today, it's a write-off. But a lot of us, we tend to not understand until we get sick. And boy, we get sick, especially us guys, but we get real sick. Right? We live it up. Don't we, Miss Sharon? We live it up with your husband. So when you get sick, I'm like, come on, not that bad, honey.
Yes. The smallest little hurt becomes a big thing.
Oh yeah,
For a man.
We're big babies, me included. But that's how God made us, I think. Now, you being in the industry you were in for many years, what do you see as an investigator for children and going to the hospitals? What do you foresee? What happened there in your industry?
Well, if a child didn't have public health care, like Medicare, Medicaid, then it would be difficult for them to be able to see the doctor. And
Wow.
when you have the Medicaid and the Medicare, you don't always get the best doctors. You get what the plans cover, because the amounts that's paid out to the doctor is very, very minimal. So usually the healthcare is done like here in Florida, it's like a rural healthcare cooperation where a group of doctors will get together and work underneath an umbrella, and but the schedules are so packed, it takes a lot for you to be able to get the child in. Only in emergency situations are you able to get in front of the line to get anything taken care of. And then if a child is like on Medicare, outside of that, you might, in order to get them in the doctor's to be seen by the doctor, you might have to go a long ways where that doctor might do more rotations, So I hadn't really dealt with children who parents had healthcare. It would always usually be the children that were on Medicare or some type of paid government assisted type of healthcare. And that level of care is different.
Yeah. Well, I've been blessed because I have businesses and I work real hard, as most entrepreneurs do, and people that even have jobs work real hard to get the best care we can. Mm-hmm. And sometimes I know it's not feasible for a lot of people, but I like to hear that people out there around the world hear different, because I know in other countries they have a different system. Like Mexico's totally different. It's very expensive there in Mexico and some other places. But the key is understanding what's available and how much the industry have changed drastically. And I thought it was great to have my doctor on to kind of share with people the difference is if you can afford to spend a little bit more money to have that kind of service, that will, because like he said on the video, what is it worth to you? Yes. So Miss Williams, now being in an industry for 50 years, give me one more thing you've seen that's changed in that industry. Went from patient to profit center.
One of the bigger changes I've seen is, and Ms. Sherian pointed this out, is for patients to be just seen by a doctor. When I started my career, the family doctor that knew you and your family and everything about you was very common. And I don't care whether you were in the farming communities or you were in the bigger metropolitan areas, you had a family doctor. Those family doctors don't hardly exist at all. And as Sherian said, doctors are in literally, and I've seen it get worse, are in groups. They don't know the patients at all. And when the patients end up in the hospital, they don't know them. And many of the decisions that I saw have been made are based on what numbers say about patient test results and not what you see in the patient with your eyes. And many nurses, especially with dealing with the young doctors out of school, have had to literally set their foot down and say, no, we're not discharging that patient today because they're not ready to go home, or they don't have a safe place to go. And that's become a bigger and bigger issue.
Yeah, it's almost like they're turning the beds over, like going to a restaurant, turning tables over. Mm-hmm. Next, keep that stream of income coming in. I know I experienced that when I went to see my doctor, and he said, listen, you might need to go see a specialist. I said, okay, great. He referred me out to a specialist because my doctor is an internalist. And I went to see this doctor, and the doctor knew, well, he didn't know at the time. When I got in the room with him, his kids and my kids went to the same school as well. So, wow. It's like birds of a feather. But when I was there and went to his office and waiting for him, there's a group of doctors, like you said, Ms. Sharon, there's a group of doctors. And when I went in there, I was there like maybe 35, 45, 50 minutes, maybe 40 minutes. But there was 50 other people in the lobby. It was like a meal, and like one after another. I was like, you know what? So I got in the room and started talking to him. He actually gave me his private number, his personal number, since he found out who I referred me, and plus his kids went to the same school my kids went to, which here again, association is so important. And I just said, this is cray. And but people go through that these days because it's so expensive. I was talking to somebody a couple of days ago. Their premium went up $800, bam, starting January. Mm-hmm. I mean, it's the same coverage, nothing added, nothing. I mean, why so much? Another friend was sharing with me, his premium went up $1,300. I'm like, so today everything is going up and people can't afford it. And one of the things they do, they drop out of paying for health insurance. It's so sad. Now, Ms. Williams, I know you're affiliated with a company that does something like that. So you want to share just a little bit about that and maybe your information to get a hold of you?
Yes. There is other options besides the known options, the big name companies that are around. There are options besides just the Affordable Care Act. There are other options out there. And one of the options is health sharing, which has been around for 40 plus years. And the company I'm affiliated with has taken the health sharing concept and modernized it in a way that it looks like insurance and acts like insurance. And I will be honest, the more people that hear about it, the more they will understand it. And we won't have situations where, as you said, people drop their insurance because they can't afford it. The negative side of that is the fact that once they drop it, they don't go see the doctor at all until it's catastrophic. And then they end something that they've taken care of 3 months ago, may have taken an antibiotic or may have been a minor surgery. Now it's a major surgery and they're in intensive care, and the hospital bill is hundreds of thousands of dollars and prolonged period of time. And there's no guarantee that they're going to come out alive.
Wow. Scary times. And you're so real and so true with that. So we'll leave your information, everybody, in the chat below. We'll leave some information if you want to get a hold of Ms. Kathleen Williams and talk about it. And I think Ms. Sherian also is part of a program that has the same thing. Aren't you, Ms. Sherian?
Yes, absolutely. The great thing about the program is that you can have your own doctor, similar to what you experienced, Mr. Thomas, with the your concierge. Mm-hmm. It's not locked in where you'd have to see a group of doctors, only this group of doctors. You can see any doctor anywhere in the United States, which makes it, and it's very affordable. And it's a great thing for seniors as well. You know, they have a great
Wonderful.
program for seniors, and which is very refreshing, because I can remember a time a family member of mine was caught up in a HMO as a senior citizen, and the HMO denied them coverage. And there's a certain period of time where you have to get out of that and go back straight to Medicare. So Medicare allows you, when it's open season, you could go in and just select Medicare. That allows you to see any doctor that you want to, as opposed to what that plan offers you. So just being aware and becoming more knowledgeable about what's available to you as a citizen of these United States. We do have choices, and sometimes when we take the opportunity to find out what those choices are, it's better for us in the long run, because it's not as expensive as we think it is, and we only hurt ourselves when we don't, seek out to try to find out what's best for us.
Well, that's very important. So folks that are in different countries, look into your insurance in that particular country that you're in, and find other options in the country you're in. Because I know we got people up from England today, from Mexico today, and people over there across the water in the UK on today. So find out what works for you in your area, and it's so important. I think the insurance companies are actually profit centers, and I think the doctors have their hands handcuffed, that they can't do the things that they want to do because the insurance company pays their salary. And I'm fortunate, I'm thankful that I was telling a story on the, if you guys go back and watch today's podcast, I was telling a story how when my doctor was at the hospital, Summerlin Hospital on the 5th floor, there's another doctor down the hallway. I was seeing him and his brother. They're both from North Carolina. I'm not going to say their names. And I go to see them. I refer to them, and they had me waiting for about, 45 minutes. There's two other people there. It was, and I was like, man. And they finally came out and saw me. And I said, Doc, out of professional courtesy, you're late. If you come to my office and I say 1 o'clock, you expect me at 1 o'clock, not 2 o'clock, right? He goes, yeah. So why is that? I said, please don't let that happen again. And it did happen again. This time I waited 20 minutes and I left. Or maybe a little longer, but I left. Because I thought we were clear on this, but evidently we weren't. Because I guess people are used to doctor. No. It's called professional courtesy. So if I say two means two, not three. So he sent me a bill, and I shared and I got his bill. I put a line through it, sent him my bill. My bill was twice as much as his bill for wasting my time.
Yeah.
Because time is important.
Yes.
And that's how they operate. They get paid by the time, so by the patient. So I was distraught. So I told my new doctor, Dr. Hansen, for the last 13 years, always on time, never had a problem. And that's one of the privileges that I consider is great. I'm so grateful for that I can do this. And a lot of more people could do this. And one of the things that could happen for people, they had a second income, a side hustle, or on another business. We talk about that on the channel. Get into something else that you can afford better health insurance and health care for you and your family. Because after all, you deserve it. Because these insurance companies don't care about us. Unfortunately, the doctor's hands are handcuffed. They can only do so much. If they don't, they get a slap on the hand. So they're under contract, guys. So with that said, go ahead. One of you ladies want to add something in there on that?
Ms. Sherian brought up an excellent point about HMOs, and because many of those HMOs, what they do to the doctors is they give them rewards for how many patients they can see in an hour. And the more patients they can see in an hour, the bigger their reward is. Coupled with the more they can keep a patient out of the hospital, the bigger their reward is. And the faster they can get them out of the hospital, the bigger their reward is. And it's become so incentivized monetarily that healthcare has gone from caring to totally a dollars, cents, bottom line business only.
Wow.
Yeah.
Wow. Go ahead, Ms. Sherian. Thank you, Ms. Williams.
I just think that when you have insurance, they have a board of directors, and they have members. They have members that are like shareholders rather, and the shareholders control actually what's being done in the insurance companies. So it's not always patient friendly. It's
Mm.
really about how much money is capitalistic and what it is greed. What is it that you can bring back to the table for us as far as how our portfolio looks at the end of the year financially. Um, but people do deserve to have better choices. They do deserve to have the best care possible. And when you have opportunities like a health share program that's available to you, that's not as expensive as regular insurance, then just just take a look and see how it would benefit the family, because when you have to pay a copay, and you have to have what they call a I forget the name of it, where you have to stack up all of the you go to the doctor, all you're paying for the insurance, but then you have to pay over and over and over again, and it's the deductible. That's what it is. The deductibles sometimes are so high, like $10,000 for each member of the family, and until you reach that deductible, you're still coming out of your pocket for the insurance over and over and over again. So you may not never even use the insurance because you're still paying on the deductible all year. So people can hold some money in their pockets. There are choices out there that would allow them to keep some of that money in their pocket, and the deductible is not as high
Yeah.
as it would be with the insurance.
Well, listen, audience, these two lovely ladies will have their information below. They both represent HealthShare, and it's a plan that is, like Miss Kathleen Williams says, it's not to replace your insurance, but it also is to add on. But it's a beautiful plan, and it's affordable. That's the beautiful thing. It's affordable for a lot of people. And they're known to save people lots and lots and lots and lots. We can't say dollar amount, but lots of money, because each person is different and each plan you choose is different. But they're known to save people money. So if you're out there looking, trust me. Some of you, you know what I mean? Your insurance went up. Like, what did I do? I haven't seen the doctor. I didn't call anything. I didn't have any accidents, and they're still going to go up. I mean, my car insurance went up. I hadn't had an accident. Everything's going up. Have you noticed? So, and especially how they're criminalizing the health insurance. We're just gouging people today, and it's ridiculous. So we're going to leave Miss Kathleen Williams' number below and Miss Sharon's contact as well, to get all these two beautiful women about a health share plan. And if nothing else, it doesn't cost you anything to contact them. And let's see what they can make and save for you, and probably give you more coverage with less money. That's the beautiful thing, because I know what they can do with the plan. So ladies and gentlemen, around the world, we want to thank you. And like I said, check out insurance in your area. And I'm sure there's some alternatives besides the HMOs. With that, Miss Williams and Miss Sharon, will you give us a few words in closing today? We want to thank both you beautiful ladies for coming on here and sharing 50 plus years as a nurse. And then Sharon, she's out here just helping people she should be an investigator for the state of Florida. So she's seen a lot of things. So thank you both. So let's end it with a comment from both ladies.
One of the comments I would like to make is that as I watched your concierge doctor this morning on the video, is to know that there is now a third generation in his family that's going to become physicians. And that is a rarity in healthcare. It's A, because the cost to go to school, and B, because of the fact that it's just expensive. Education is expensive.
Yeah. Thank you. Well, I was joking in the video. I said, this is where my money goes. Look at his office. But what is it worth to have your doctor's private number, to call them anytime? See, people don't understand value. They don't put that until they have a problem, and then they still can't get the connection. So, and that's why I talk about eating healthy food with fruits and vegetables that have seeds in them, because everything's been modified in the 70s, 80s, and 90s. And if they don't have a seed in it, folks don't buy it. It may cost you a little bit more for the seeds, but that's how God made it. God said the seed within the seed. Well, anyway, just get, so anyway, you got to understand, it's a blessing to be able to do this. And I wish all of you could, but like I said, get a hold of these ladies. Miss Sharon, go ahead. What's your final word?
Well, it was refreshing to see your physician have such a personal relationship with you. I'm blessed to be able to have a personal relationship with my physician, and it's priceless. you know, and for him to be able to take time out of his busy schedule to share information with us, it's just priceless. So I appreciate the platform giving us an opportunity to see what it's like to have a personal relationship with your physician, because most people don't even know how that feels, Mr. Thomas.
They really don't. Thank you. That's a good point. And the beautiful thing is having that the relationship. Even his wife is worth there. I mean, it's so important, folks. Everything is relationship driven these days, and you need to develop relationships with everybody, every walk of life, because you never know when you're going to need them. You know, I'm just grateful and fortunate enough that I have that relationship, and I'm grateful that I can let the other doctor. I can say I actually fired them to go to him, and it's been 12 years, and I never had a problem. Plus, you know, I mean, think about it. I got his own personal number. I call him anytime I need him, no matter where I travel. So, folks, I'm not saying this. I'm saying if you can't afford, get with these ladies. Their information below. We want to thank everybody from all over the world today joining in, because hopefully this sparks us an interest in, maybe I need to dive into something else. Maybe I need to look at my other options. So we want to thank you from around the world. And if you can, leave a comment if you can. And next, hit the subscribe button. Join the community, because we try to give people, it's what's called all things business. So we're talking all aspects, not just one. And you're going to get educated on different things and different topics here. So we want to thank you for your time today. We want to thank you guys that are watching from anywhere in the world. We want to say thank you. And please leave a comment. God bless you, ladies. Thank you, Miss Captain. We're from Sacramento. Miss Sherry, I'm Florida, down in Florida. Thank you so much. And you folks around the world, God bless.